I've done a lot of videos on the immune system. Today, we're going to talk about what to do once you get an infection and what is the fastest way to overcome this infection. Well, the first thing to do is to kind of figure out or guess if it's more a viral infection or a bacterial infection. So with a viral infection, it's going to be more systemic. So you're going to probably feel more body aches, chills. With bacterial, it could be more localized to like lymph nodes or maybe urinary tract infection or food poisoning. A fever in a bacterial infection goes a little bit higher than a viral. So if your fever is really super high, potentially could be more bacterial. If you get a sore throat with a viral infection, a lot of times you'll have a runny nose and a cough. But with a bacterial sore throat, you're going to feel just like more pain and localized without the runny nose. That's a type I used to have every single year growing up. It was terrible. With a virus, you'll have more of a dry cough, bacterial, productive cough, which means there'll be mucus involved. Typically, when you have a respiratory infection, sinus or lung or bronchitis, think viral. But if you have pneumonia, you could have both bacterial and virus, except sometimes in a childhood illness, you'll get pneumonia, viral pneumonia. But if you have like the common cold or a flu, that's typically going to be viral. Now, as far as how long these infections can go, with a viral, it could be 1 to 2 weeks. With the bacterial, it could be a little bit longer. And this all depends on your immune system. The mucus with a viral infection usually is clear or white, but with a bacterial infection, it's more green or yellow. There's a couple remedies that I recommend for viral: elderberry or olive leaf extract. For bacterial, I would recommend garlic, oregano oil, and echinacea. Think about echinacea. If you can catch this infection in time and you take echinacea, you can sometimes stop it from going into a full-blown infection. Now, at the very end of this video, I want to reveal something very important about a sore throat. It's a technique. You want to take a hot bath or hot shower and dress very, very warm to the point where you're even sweating. Why? Because we want to cook the virus or bacteria. We want to heat you up to the point where we can kill off this infection. The side effects from this infection really are your immune system killing off the microbes, and your normal cells are also being affected. So really think about this as not a bad thing. It's just that your immune system is working. Go to bed early. The more sleep you can get, the better. A lack of sleep will really weaken your immune system. I think it's really important to take zinc, vitamin D, and vitamin C. Fasting, I think, is a very, very good thing. That way you're stimulating your immune system and allowing your immune system to work. And when you fast, you actually increase your survival genes. They start to kick in, and there's a lot of benefits from fasting that go way beyond just your immune system, but fasting will help your immune system. Sea salt is a very important thing. Sea salt also helps increase the parasympathetic nervous system and decreases the sympathetic nervous system. Sea salt can help you sleep at night. The other thing that's really important is to do whatever you can to improve your emotional state, whether you have anxiety or depression. Go for a walk, listen to music, do something to pull yourself up, because infections last longer in lower emotional states. The sun gives us many cool things that go beyond just making vitamin D. It also gives you UVB, which is anti-inflammatory. Also, the sun gives you infrared. And infrared can do a lot. It's anti-inflammatory. It can increase melatonin. It's immunoregulatory. It helps sleep, repair, enhance the mitochondria. It can increase killer T cells. And it can even dampen the cytokine storm. Many, many, many times when people get sick, there usually is always some type of predisposing factor, like some type of stress that allows this infection to take over. So anything you can do to reduce that would be very, very good. And this is why they give prednisone, which is a synthetic version of cortisol, to any type of immune problem that someone has, and it gets rid of it. It suppresses it. If someone is low in vitamin D or zinc, they can be more susceptible to having an infection too. Also, you should make note that when you eat refined sugar or refined food. That can deplete zinc as well as vitamin C. The chemistry of vitamin C is similar to glucose. And so if you're consuming any type of sugar while you're consuming vitamin C, you're going to block the absorption of vitamin C because the body's going to take in the sugar. As we age, the thymus gland, it's a little gland on top of the heart that really is so important in training your T cells. It starts to shrink as we age. So when we get older, our immune system gets weaker, unfortunately. If you have microbial imbalance in your gut flora, or you don't have enough microbiome diversity, that can put you at risk for having a problem as well. And of course, sometimes people have this idea that I'm going to try to kill off this infection by, doing a shot of whiskey. No, I wouldn't do that. It's not going to help you. And another good remedy is cod liver oil. Why? Because not only does cod liver oil have the omega-3 fatty acids, which are anti-inflammatory, but it has vitamin D and vitamin A, which supports your sinuses, your throat, your GI tract. I used to have a lot of sore throats. And in practice, there was something that I came up with that I think is mind-blowing. And it's one of those things that you just have to try out to believe it. And I have a video that I'm going to put up that you can watch. It's a simple technique that someone can do on you to help give you relief of the soreness of your throat infection. Now, I'm not saying it does anything for the infection, but it'll definitely reduce the pain and soreness that you have if you have a sore throat. So what you're going to be doing is you're going to have someone press on the exact opposite part of where the sore throat is. So if you have a sore throat like right through here, you're going to have someone pressing on the back part of your neck. To get a full detailed understanding of what it looks like and how to do it, I put that video right here. Check it out.